Welcome to Tripping Over Love, where we talk all about breakdowns, breakups, and breakthroughs. I'm Courtney Corona with Keith Miller.
Hey, so I wanted to talk with you about this really interesting study that came out in the journal Nature. Washington Post reported on it this past week. The headline is "Science shows very different psychiatric disorders might have the same cause," and that the study goes into details, a 5-year study of multiple disorders. Like I think they studied 11 or 12 mental health disorders, ADD, neurotypicality. Is that a word?
I don't know. What does that mean?
Neurodivergence.
Oh, okay. Yeah.
ADD, neurodivergence, anxiety, depression, schizophrenia, bipolar, Tourette's. And they found that these illnesses are, linked genetically to the same causes, the same roots genetically.
Which was not believed before?
It was just irrelevant data because we just started treating these. We found in the 50s and 60s a bunch of drugs, the monoamine, neurotransmitter theory came of essence in the 40s to 60s, I want to say. And so we had access to these drugs that mimicked neurotransmitters. So we just started giving singular or mono therapies like serotonin, norepinephrine, dopamine. One medicine affects one of those neurotransmitters.
In layman's terms, are you basically saying it's not like they were treating the full? They were trying to treat what they believed were individual underlying causes.
Yes.
Of each mental health disorder.
Yeah.
Okay, and then we're not, but did not look at the commonality between those.
Right, and that would lead to things like the study author, I think his name is Grotzinger, used this analogy, and he said, it's like you have a cold, and you go to the doctor, and the doctor says, well, I'm going to give you this medication because you have runny nose disorder, you have sore throat disorder, and you have fever disorder, without realizing that they are just part of the symptoms of a cold. And so similarly, we don't do that, obviously. We treat all the symptoms, but we know it's a cold. And that affects the course of our treatment. Similarly, we have these siloed psychiatric diagnoses that we now know through the emerging science of psychedelics and the systems in the brain that respond to psychedelic medicines. We know that there's so much overlap in brain function. So ADD medicine is going to help your depression.
It helped mine.
And that's conventionally known if you practice medicine, but it's also not conventionally known for most people that, the same things treat, the same drugs, different drugs treat the same thing.
So why is this so exciting?
Well, just to read from it, the findings could spare patients some of the burden of carrying multiple different diagnoses that require an assortment of different pills. So, we're on the verge. And it's exciting because my son is studying chemistry and molecular and that industry, especially with quantum computing and AI, is about to explode with the number of interventions we have, the number of molecules that we know how to make. Is currently mostly by accident. We have this small slice of chemicals that we know how to make, that we know what they do. And with the computing and technology, we'll be able to actually say, I need something that does this. And the software, the engineers, will be able to come up with here's how you make that molecule.
Right.
And here's how you can predict and model what it's going to do.
Personalized medicine.
So,
yeah, you were really excited about this when you...
Yeah, I think it's an exciting time. I think if I was going back to tell myself what field to go into, I would say neuroscience. I would say just go back to community college, get your math, and science courses up to snuff. And
versus as a therapist.
I mean, I like therapy, and it's been a really successful part of who I am, but I do think that it's two different things. There's a track of helping each individual starfish, that gets washed up on the shore, the sort of fable of, why did you throw that starfish back? There's millions of them. Because it helped that one.
Right.
And so, I do believe that.
But this is that course would have been a bigger.
Yeah.
You're helping many.
So the quote from one of the authors is, "What's so wonderful about this paper, and one of the reasons I'm not retired yet, is that I strongly believe that psychiatry will change more in the next 10 years than it has in the last century. And it's work like that that gives me hope that my opinion is right."
This is one of the authors of the Nature?
This is Scott Aronson, Chief Science Officer, Shepherd Pratt Institute for Advanced Diagnostics and Therapeutics in Baltimore.
Oh.
So he'd be a cool person to talk to.
Yeah, for sure.
Love to interact with those people. And yeah, I think it's something fun to watch. A lot is changing and a lot of good, hopeful things in medicine for psychiatry.
And there's so much change needs to be happening, right? There hasn't been a lot that has shifted.
I mean, look, we know a lot more than we did before the 40s. But God, it's still the dark ages.
Well, still, and it hasn't really advanced from the 40s. Of course, there's been advancements. There are SSRI, like all sorts of things, but it's kind of slowed over the past 20 years, with the exception of psychedelics, I think.
Yeah, I think we're due for a major renaissance in mental health care. So prior to Reagan in the 80s, when I first became a social worker in the late 90s, or early 2000s, the effects of deinstitutionalization, which came out of the Reagan administration, which is tame compared to the decentralization that we're seeing now, but it was radical at that time. Before Reagan, the healthcare system was more robust. The mental health care system was so well funded, and these centers and hospitals were built all over the country, and they were built like college campuses.
Wasn't that Kennedy who did that?
Kennedy, I want to say Nixon.
Okay.
As well.
I could be wrong.
Johnson.
Don't quote me on that.
I mean, there's a lot of administrations there that just grew the size of government, and that's why we're having this debate now. Why is it so big? But that was one of the benefits, is that people who were mentally ill would be housed in these facilities for their entire lives. Now, you had people being over-hospitalized.
Right, and treated really horribly.
Traditionally, a lot of women...
This is where our debate always happens, right? Where,
no.
Yeah.
If you've watched Mad Men, you know the psychiatrist interactions with the women, the wife in that movie, you realize that women were institutionalized because they were having emotions and they were labeled hysterical and mentally ill. And
also it was a way to get a divorce without being labeled. So I actually have been studying a lot randomly, don't ask me why, about institutions earlier than that in the early 20th century. Oh yeah,
you got to read Mad in America. That's a good one. Yeah.
I'll read that. But there's a lot of women who just pushed back on their husbands and spent the rest of their life in institutionalized, no control, no rights, anything. So yes, more support is certainly needed, but it needs to be different support. Yeah, no, we just the level of care that they would have in those hospitals was interesting, but they experimented a lot more violently with patients, like electroconvulsive therapy, lobotomies is a horrible period in time where this procedure was being taught by one particular surgeon, where he could do a prefrontal lobotomy, which is basically taking like an egg scrambler to this part of your brain right behind the eyes. And he could do it under general anesthesia behind somebody's eyeball. Just move the eyeball and just go kill. I didn't realize it was under general anesthesia. Yeah. Local, I think. I mean local. My brain went to local. It was like semi. If it was local, it was not like a big procedure. Gosh. So they, and it truly changes. Like the story of Phineas Gage. Anybody who studies psychology, the railroad worker in the 1900s, tamping on a hole to put dynamite in, and hit. The dynamite lit, and the tamping rod, big steel rod, went through his neck and right through the center of his brain and like flew out, actually. And he had this hole. He survived miraculously, and he could function. Most of his functions were there, but his brain was fundamentally changed because it cut it in half. Right. That was one of the biggest insights we had about behavior and how it changes when... Because he became a totally different person. He became a total raging asshole, and violent and drunk, and his personality was gone. So the point of that story is prefrontal lobotomies change the personality and disable the person from having real like agency and control, which for somebody with severe schizophrenia seems like a gift. Like you're going to help them basically
be more of a vegetable. If you've seen One Flew Over the Cuckoo's Nest,
It seemed like a gift years ago.
it seemed like
it
a
does
gift.
not
It
seem
was
like
it
a
was
gift
torturous
now.
and
Oh,
barbarous.
it's horrible.
So yeah, we've come a long way. Medicating people, institutions today, people do get over medicated, but it creates a calmer environment. There's sedatives and like Seroquel, like for schizophrenia, is sort of a miracle drug for helping people not be out of control. So anyway, yeah, I do think there's going to be a renaissance where we're going to see more clever and more ingenious ways of treating people, and hopefully recognize that violence, especially gun violence, is a health disorder. I mean, there's the movements in the medical community to get government agencies to recognize that, because the CDC has been not allowed to track violence as health epidemics. So we can't even isolate. There's lots of studies in community work that has been done where when they know where the violence is, they can go in with targeted community interventions, not policing, behavioral interventions. Like, these people are at risk for violence because of the mental conditions that they're in.
Yeah.
And so you can see dramatic de-escalation in gun violence in those communities. So it's like we know how to do these things, but we're so stuck in this issue of are we going to fund programs? And
we're not. I mean, the government. We're just not prioritizing the right things. It's absurd.
It's absurd.
It's absurd.
So,
but some promising news.
Promising news. Thanks for listening to Tripping Over Love. Subscribe now to make sure you get the latest episode, and drop us a comment or a question. See you next time.